We have to understand what are the different types of gastrointestinal disturbance. Gastro means actually stomach, and intestine means small intestine and large intestine. So there are a lot of diseases which are affecting our stomach as well as our different regions of the intestine. And these diseases are actually coming under the category gastrointestinal disturbances. So we have to see what are the features of that before. So gastrointestinal diseases are those that affect any region of the gastrointestinal tract. Gastrointestinal tract means from our mouth to up to our rectum or anus. The gastrointestinal. For example, it starts in mouth, then goes to pharynx, then goes to esophagus, then comes the small stomach, then comes the small intestine, large intestine, rectum, anus. This is how the gastrointestinal tract. And there are a lot of glands are also associated with that. For example, liver, pancreas, all these are part of the gastrointestinal system. So any defect or any problem that affect any of these organs can come under the category gastrointestinal disorder. So the term encompasses means includes acute or chronic or recurrent. Chronic or recurrent means repeated. Chronic means for a long time. Recurrent means repeating. Or functional disorders and covers a wide range of diseases including inflammatory bowel disease. It's a very chronic problem of some people. I will tell you about that. Then some other is a dyspepsia. That is also a different type of. I will tell you what is dyspepsia. Dyspepsia means actually upset stomach. It's a comfort in your. It's basically a type of indigestion that is known as a dyspepsia. So these are the different type of gastrointestinal disorders that is affecting us. Now we'll come to the major category. The first disease is found by the name diarrhea. Diarrhea is something everybody knows because when you have a diarrhea, your motion or you will have a loose stool. So that is a common feature of any diarrhea. Symptoms of diarrhea include frequent. Frequent means repeating. Often loose watery stools. Watery stools means your fecal or excretory matter is what we call stool, which are usually accompanied by urgent need to go to the toilet. So you have some kind of stomach problem, you may need to you have a immediate need to go to the toilet, and it will be sometimes a painful experience also for many people. So there will be abdominal pain if it is very severe, and cramping. Cramping means abdominal contraction will be there. Then sometimes vomiting will be there, sometimes nausea will be there. So most of the time the diarrhea is actually caused by some kind of virus, sometimes bacteria, maybe also bacteria may also be responsible. So viruses are common cause of diarrhea, particularly type of virus coming under the category norovirus, which are the common cause of diarrhea or vomiting outbreak on cruise ship. So that is one type of virus that is responsible. But most of the time, many bacteria like Salmonella, Campylobacter, Escherichia coli, Giardia, then and certain other medical conditions like celiac disease or Crohn's disease. So these all will be leading to some kind of diarrhea. So in any kind of diarrhea, most of the time, for example, you have a lot of medical like loperamide or dipenoxylate that will help to slow down the bowel movement. For example, you might have read about a drug medicine or lomotil. Lomotil will be containing this chemical known as loperamide. Based when you have too much diarrhea, you may have to take this lomotil because what it is doing, it will help slow down the bowel movement. So that is how bowel means intestine. Your intestinal contraction and relaxation and that movements of the intestine that will be slowly reduced. That is the effect of this loperamide or Lomo. The trade name is Lomotil. Another drug is dipenoxylate. So both are working in the. Then another method, another kind of approach to diarrhea is that when you are having a diarrhea, a lot of water will be lost from your body. Along with your water, a lot of salt, okay, sodium, salt, calcium, salt, potassium, salt, all these will be lost from your body. So electrolyte solutions are beneficial for treating dehydration, which commonly occurs in excessive diarrhea. So that is one. So what the problem is that, for example, you might have heard about ORS. What is an ORS? Oral rehydration therapy or oral rehydration syrup. What we are doing is that we take a glass of water and we take a spoon of salt and 2-3 spoons of sugar also, and this spoon of salt and sugar will be containing glucose will be there, enough sodium chloride will be there, so that will be able to replenish or give back whatever sodium chloride and whatever glucose that has been lost from your body. It is a very simple thing, but it is a life-saving thing, because if there is too much water loss, your body cells may not have enough water, and that will lead to a situation known as dehydration. When too much dehydration is there, there will be a cardiac arrest or something can take place. So sometimes we have to go for antibiotic treatment. So normally the three type of approaches are there. One is to reduce the diarrhea by giving drugs like loperamide. Another is to supplement the lost minerals by giving ORS. Third approach is to treat the bacteria which is responsible for the diarrhea by giving antibiotics. Now we have another kind of disease known by the name Crohn's disease. So in the case of Crohn's disease, that causes patches of inflammation in the gastrointestinal tract anywhere between mouth and the anus. I will show you the picture. See here, you can see that. This is the Crohn's disease. Now these kind of regions where some areas will be swelling. There will be swelling in some area, or sometimes inflammation or swelling will be. So this is how a normal stomach, in the inside wall of a normal stomach will be there. In the case of Crohn's disease, certain regions will be inflamed. Inflamed means swelling will be there. So that can happen anywhere from your mouth up to the anus. Sometimes in esophagus, sometimes in stomach, sometimes in esophagus. So in any part can be affected. The exact cause remains unknown. Nobody knows. There are a lot of such diseases are there. However, it is more common in Western countries or Westernized countries, and also run in families, means some genetics connection is there or hereditary connection is there, and diet and stress may aggravate the disease, because the stress can be an important factor. Your diet, for example, when you have too much tension, every day you are coming home with a lot of tension, but because every time when some tension is coming, you may feel that something is affecting your stomach. So every time you are having tension or stress, that will be create too much physical problems for your stomach and intestine. So one way of leading a happy life is to reduce your stress. As much as you can reduce your stress and your tension, and you can settle, even though you don't have many great things in your life, but if you are tension free, if you are stress free, you can enjoy a life, and you will feel that life is always very beautiful. But all the time you are taking too much tension, too much stress. Maybe sometimes even when we have there are certain things where fighting may not be always successful. I have heard that what you cannot get by victory, you have to take by losing. There is because sometimes when you are losing before something, even though you deserve the victory, sometimes simply for some people we lose. We accept failure. Even if failure is bringing happiness, always choose that. If success is not going to give you happiness, choose the failure. If failure is what is going to give you happiness, that may be a good strategy to keep you happy. Because after all, our happiness in life is more important than everything in life. So if you are happy, you live longer. So that is an important strategy that you have. That is why here you can see that diet as well as stress is an important factor. And symptoms may include diarrhea that persists for several weeks, abdominal pain, and weight loss. Sometimes, when these sort of problems are there, it may be continuing for several weeks. You will have abdominal pain will be there, and since your digestion is not proper, your absorption of nutrient, you are eating a lot, but still you look very lean, you look very skinny. So there will be weight loss will be there. So around 50% of the people with Crohn's disease notice blood or mucus in their fecus. So there are a lot of other reasons for presence. So for example, piles. You might have heard about a disease called as piles. It is a discomfort affecting a lot of people. Nobody openly says that, but it is a regular problem for many people in several families. So presence of blood in the or mucus in the feet can be a problem with the Crohn's disease, and some may report urgent need to move their feet, bowels, or sensation of incomplete evacuation, because you know that if your rectal evacuation, or if the excretion is not proper, not complete, that gives you a discomfort throughout the day. So that is one good habit that you have to practice. Every day morning itself try to empty your bowel, so that rest of the day you will have a tension free. Otherwise, if only 50% is gone, the other 50% can create you a lot of trouble. So because as far as the toilet the hygiene is concerned, there is one important thing is going to the toilet at the same time every day. For example, you have the practice of going to the toilet at 7 a.m., 7 o'clock in the morning, and for some days you are postponing it to 9. Then next day you will have the reaction. If for 2-3 days you are postponing it to 9 o'clock or 10 o'clock, then next after that you will have difficulty going to the toilet or emptying your bowels completely that day. So one important rule of toilet hygiene is that go to the toilet every day at the same time. And if you change that time, you will have trouble. So that is an important practice. Then another problem is that this toilet practice is for you are changing the place. For example, you are going for a study tour, or you are moving to some relatives home. Then next day you will have the problem in your stomach. So that even the change of place is a problem. So these are simple things everybody is experiencing, but most people don't talk about that. But it is a big trouble, big headache for most of the people who are having it. So drug treatments may include aminosalicylates, corticosteroids, immunomod. So there are a lot of drugs. Sometimes we have to also, but any problem affecting your stomach or intestine or rectum is really a headache. It's always very discomfort thing to go to the doctor, and doctor is examining all these areas of you. It's not a very pleasant experience for most people. So this is regarding the Crohn's disease. Now another common disease is known by the name celiac disease. Now it is an autoimmune disorder. What is an autoimmune disorder? You know, our immune system is fighting against presence of other bacteria and virus entering your body. Sometimes what happens is that your immune system is working to destroy your own body cell. That is known by the name autoimmunity or autoimmune disorder. So this happens where small intestine is hypersensitive to gluten. So there is a gluten is an ingredient present in wheat. Some people who are eating wheat will be having this problem. Ingestion of gluten causes immune system of body to attack the small intestine, leading to damages of villi of the small intestine. Here you can see that. So this is how a normal you might have studied about villus and villi from high school classes also onwards. So it is a small finger-like projections on the inner wall of the small intestine. So normally this will be appearing like that. When there is small intestine, when there is celiac disease, this villi will be affected by our own immune system. So this will be appearing like this. So this is a problem with the celiac disease. Our own immune system is attacking our own intestinal cells. So celiac disease can start at any age, and symptoms include bloating, changes in your bowel habits, sometimes too much diarrhea, sometimes too much constipation. These are the problem. Then rashes will be there, weight loss will be there, poor growth rate in children. These are some of the problems that so only way by which you can go for, because during the time when you are a child, or during your childhood, it is most sometimes parents may not be aware of that. Only the problem is repeating again and again. Parents may be taking the children to the doctor, and finally after several years only the celiac disease may be confirmed. So the best approach is to go for a gluten-free diet. So gluten is a substance present in many wheat products. Then that is a celiac disease. Now we have another different type of disease is known by the diverticular disease. It's a chronic condition in which small pockets of outpouching called diverticula occur in your bowel. I will show you a picture. See, this is how a diverticular disease is appearing. So this is the large intestine. Small kinds of outpockets will be appearing like this, and these are known as the diverticula. So diverticula can become inflamed when undigested food gets trapped in them. See here that when food or digested or semi-digested food is moving through the intestine, some of the food can enter into these pouches, where they remain larger, so that proper digestion may not be taking place. So what happens is that diverticula can become inflamed. Inflamed means inflammation happens when bacterial attack is developing. So when undigested food gets trapped within the, causing pain and constipation, and sometimes fever, nausea or cramping. This is called diverticulitis. It affects people. It affects half of all people, especially during the time of old age. See here it is written. About 50% of more than 50% of the people over the age of 60 are having this diverticular disease. So when we are aging, just like any aging vehicle, we will have a lot of problems with our different organ systems in your body. So what we can do is that a low fiber diet is thought to be the main cause of. So sometimes when at home your parents may be telling you that eat a lot of fiber or narir. So fiber rich food is an important way of keeping your stomach and intestine in good working condition. Because if you are eating all the time chicken, it doesn't have any fiber. There is no problem in eating chicken, meat or other thing, but the amount of fiber is very low. So if you have the practice of eating too much meat, what you can do is that compensate by taking a lot of fiber rich vegetable. So when you eat a lot of fiber rich vegetable, that will keep your bowel movements proper, and you don't feel any diarrhea or constipation, and you have a very healthy bowel movement, so that you will remain healthy, because that can be a source of tension. If your stomach is not completely empty, it can be a slight source of tension, and all this tension will be building up, and slowly that can lead to a lot of stomach, that can again create more stomach problem. So one way by which you can go for is that a low fiber diet is sometimes the main reason. So most people don't have symptom, and condition is often discovered during a colonoscopy. Have you, if anybody has done a colonoscopy, it is just like an endoscopy. Now doctor will give you some medicines to empty your stomach, and they will insert a tube into your anus and with a camera, and doctor will be able to see the inner regions of the stomach, and that is known as a colonoscopy. Just like endoscopy through mouth, Colonoscopy is through an endoscopy conducted through your anus is known as colonoscopy. But all these are difficult experience for a person. So that better manage your system properly. Otherwise, you will have all this treatment. So many people don't have symptoms, and only through colonoscopy, if there is any cancer or something. What happens is that this is if food particles are lodged here, trapped here, there will be bacterial attack, and sometimes if there is permanent food presence there, that can lead to cancer later. So this is the problem with the diverticular disease. So best thing, go for a high fiber diet. So in Kerala, we are very poor in taking fiber-rich food, because most of the time we take some people in family. Morning there is rice, maybe kanji. Lunch will be rice. Dinner also rice. If you are taking rice 3 times a day, definitely you are inviting diabetes and other sort of problem. So best thing is that limit the rice up to only lunch. But if you have the habit of taking rice again chore in the night also, it is not a good habit. So that is why, but in Kerala this is the system that we are practicing, and that is why we have a lot of diabetes in Kerala. So that if you go to USA, there people are obese, but the amount of percentage of diabetes is very low. India is considered as a diabetic capital of the world, and Kerala has a high rate of diabetes. So that is regarding the diverticular disease. Now we have another disease is known as hemorrhoid or fissures. Hemorrhoids are popularly known by the name piles. What happens is the hemorrhoids occur when anal cushions, which are small areas of vein containing tissues that seal the anal opening or preventing incontinence, become engorged or swollen. I will show you how this is appearing. See here, you can see that this is the rectum and this is your anal opening. So what you are seeing is that some blood vessels are bulging or swelling is there. So this is the anal opening and this is the rectum. Here you can see that sometimes some of the blood vessels will be swelling or inflamed, and sometimes some blood vessels will be present inside the rectum. Some will be coming out from the anal opening, and sometimes it will be appearing like that. So this is the internal hemorrhoid and this is the external hemorrhoid. Popularly this is known as the piles. So what happens is that when piles or hemorrhoids are there, when your bowel, when motion or stool is passing through that, sometimes these hemorrhoids break, rupture, and blood will be coming out through your anus. So this situation is known as a piles. It's a very painful, very difficult situation. Sometimes in some families piles are common. So the only thing is that change your lifestyle, change your diet. I will tell you. They can occur either externally or internally. External hemorrhoids look like small bunches of grapes and become very red or tender or itchy when inflamed. The same thing coming out of your anus is known as external hemorrhoid. See here, you can see that. This is the external hemorrhoid at the rim of at the edge of the anus, and this is the internal hemorrhoid. Internal hemorrhoid can cause a feeling of pressure inside the rectum, and all the time you are feeling that something is there in your rectum. So if there is something in your mouth, you will be feeling it all the time. Similarly, if something is present in your rectum, that feeling will be there. That symptom is known as internal hemorrhoid. Occasionally they may prolapse. Prolapse means move to one side or move away from the normal position out of the rectum and may pop out of the rectum following a bowel motion. Here you can see that. This is an internal hemorrhoid. Sometimes what happens is that when stool or your bowel is moving, this this internal hemorrhoid may come out to the anal opening. It is a very painful situation. Many people are experiencing it in their everyday life. So that situation is known as the internal hemorrhoid, and popularly we call it by the name piles. It's a very difficult, if somebody in your family is having a piles, you ask them what are the difficulties of piles, they will have a lot to say. How much discomfort, how much pain they are experiencing. So this is known as a hemorrhoid, and there is another situation known by the name fissure. Now I will tell you what is a fissure. See, here also this is the rectum, and this is the this is also a close-up of rectum. Now what happens is that when you are having constipation every day, you are taking too much time, too much pressure to empty your bowel. What happens is that sometimes that create a rupture or now some rupture or tearing of your internal linings there. See, here there is a bleeding there. A part of the skin is actually torn. So there is some skin breaking is there. That is known as a fissure. Fissure means splitting or a break. So when there is a splitting or break or a tearing of your muscles or skin there, it is known as a fissure. This may appear very, but only for a person who are having an anal fissure, going to the toilet is almost like a nightmare. It's a very painful experience of simply emptying your stomach. Because of the presence of an injury, presence of wound here, moving the bowel out of your anus will be very painful. So that situation is known as anal fissure. Only through colonoscopy or sigmoidoscopy you will be able to understand what is the problem. There also blood will be coming out of your anus. So in the case of several disease, it can be this anal fissure, or it can be hemorrhoids, or it can be sometimes celiac disease. All these cases, blood can come out of your anus. So this is known as an anal fissure. They are commonly in. So one important reason for anal fissure is constipation. That is why from the beginning onwards I told you, keeping a healthy bowel practice is a very important part of being happy. Please don't talk. So practice proper bowel hygiene, bowel movement is very important because if you have some kind of problem like that, even if you are very successful in your life, you will be facing too much problem. I told you about one. There is a Japanese prime minister. I forgot last. He resigned 2-3 years back. I think there was a lot. He was a very famous person. Recently some assassination attempt was also there. He had a problem, and he resigned from that post. The only reason is that he had a what is called irritable bowel syndrome. So because of that, if he resigned from his post, he said, I am unable to do my daily duties. So that is why even if you are successful, if your intestinal hygiene, if your stomach hygiene is not proper, you will be experiencing a lot of trouble. You cannot convey this difficulty to the most people. So that is the biggest headache of this. So what you can do is that from a child, from your normal childhood way, practice normal bowel hygiene and take a lot of fiber-rich food. And so fiber-rich food, then a lot of exercise. As I told you, good bowel practice. All this will be helping you to stay healthy. For example, sometimes if you are having any kind of surgery, during the time of surgery, they will be giving you some kind of opium-related anesthesia. Most of the anesthesia will be containing some kind of opium. This opium is a constipation-making drug. So most people who are having a surgery will be experiencing constipation immediately. So when you are having some kind of problem like this, that constipation after the surgery will be very severe, and sometimes anal fissure will be developing. If so, only thing that you can do to keep all this, do not allow constipation. If you allow constipation for 1 day or 2 days, then all week you will be suffering. So keep the bowel movements proper, keep your stool soft by taking high fiber, right? Only when you experience some problem like that, you will understand how severe these problems are there. So another is the polyp or rectal cancer. Here you can see that these are growths that occur on the inner surface of the colon. So this is what we call as a polyp, a small outpouch from the inner wall. There are two types are there. One type have a high risk of turning into colon, colorectal cancer, and it should be completely removed immediately. So you might have heard about colorectal cancer. It's a third leading cause of cancer among American. So that's a problem. So colorectal polyp, see this kind of polyp, the problem is that in the beginning it may not be creating much problem, but it has a tendency of turning into a cancer. So that is a problem of colorectal polyp. Then most colorectal cancer grows slowly and cause few symptoms until they reach a. So this is the biggest headache. Nobody will be able to do. So if there is a problem inside your rectum, your colon, it all become visible or noticeable only when the problems reach maximum. The problem become more significant or more life-threatening. Only then the disease will be properly diagnosed. So colorectal cancer is more common in people aged 45 to 75 years. So what we can is a cancer. So we do not have a very full treatment for a cancer. Only thing, either we go for a surgery or we go for a chemotherapy. Chemotherapy means high dose of antibiotics. That has a lot of side effects. Or we go for a radiation therapy. That also has a lot of. So none of this treatment approach for cancer is a very full treatment. It has a lot of risk, but it can to somehow extend the life of the person by several years. Then ulcerative colitis is another big problem. In the case of ulcerative colitis, that will be affecting inner lining of colon, causing whole of the colon to be inflamed. The symptoms are similar to Crohn's disease and include more diarrhea and frequent need to bowel move. This is another bigger headache for many people. Ulcerative colitis. Some part of your stomach will be having, intestine will be having this sort of inflammation earlier. This sort of inflammation will be present. It is known as a ulcerative colitis. In large intestine or in colon of your intestine, this kind of inflammation will be there, and sometimes that turns into an ulcer, producing causing lot of blood loss also. So that situation is known as ulcerative colitis. That is also a difficult situation. Sometimes by taking some steroid drugs, anti-diarrheal drugs, we can reduce the severity of the problem. Then peptic ulcer. Peptic ulcer is another big headache for most people. Here you can see that how the peptic ulcer can develop. Most of the time it is caused by a bacteria known as Helicobacter pylori. Helicobacter pylori is one of the important bacteria responsible for this peptic ulcer. Then overuse of anti-inflammatory drug aspirin, ibuprofen, diclofenac, excessive acid. So one thing is, if any drug whether it is English medicine, Ayurvedic medicine, homeo medicine. All drugs have their own side effects. So as far as possible, reduce the use of drugs. So if you are in the habit of taking too much drugs for a very silly thing, try as far as possible. Try to reduce the dependence on drug. So then another type of drug is duodenal ulcer. The first part of small intestine is known as the duodenum. That can also cause us of many problems. So peptic ulcer are small holes that occur in the lining of your stomach. Here you can see that when one of your stomach wall has a hole, the blood will be coming out through that. That is known as a peptic ulcer or stomach ulcer. It can be gastric ulcer or duodenal ulcer, or some most of the time may be caused by some kind of bacteria. So there will be abdominal pain will be there, heart pain will be there. So this is how the stomach ulcer can create lot of problems for you, and the best thing is to go for a treatment so that the Helicobacter pylori infection can be cured. So there are a lot of problems regarding gastrointestinal system. So it is a problem that affects several people, but very little is being discussed about this.